I woke up unable to breathe and really quite scared about it. Felt like there was an anvil on my chest, really heavy compression on the chest, a lot of pain shooting along the left-hand side and down the left arm, difficulty breathing, really hard to breathe, dizziness, fever, nausea, tinnitus. It was all kicking off really at that point.
Long COVID is essentially like a blanket term, and it basically means anybody that has symptoms after 4 weeks from becoming unwell with COVID. Post-COVID syndrome tends to be a condition that is defined at around 12 weeks in those patients that have persisting symptoms following COVID, and those can be very far-reaching symptoms.
At that 12-week mark, when symptoms are really starting to sort of embed, that's when we were accepting referrals into our service.
Every day was like a nightmare because it was suffocating. I felt like I was being strangled and suffocated. What I've learned about this illness, it hits different parts of you as an individual, whether that's psychological, mental or physical.
Very, very early on, it became apparent that the after effects of long COVID were really, really far reaching, and often affected those patients who initially had quite a mild initial illness within the community. That realisation came that it needed to be a service that actually was able to manage the full range of symptoms and symptom burden for patients.
It's really important to have contact with the GP, and the GP is able to signpost to services more locally, and especially thinking about psychological therapies as well, if that's important at the time.
And the emotional impact's been huge. I remember in April when I just wasn't getting any better at all. I remember sitting on the end of my bed and just crying because it was non-linear. There was no end to it. I just waking up every day feeling like I was being strangled, and that was if I could actually sleep, because if you can't breathe properly, it's really hard to sleep. And I wasn't sleeping, and of course you need sleep to heal, and the emotional impact's been huge. I felt really quite low and vulnerable and lonely and on my own.
Being unwell with anything has an emotional impact. I think being unwell with COVID has had a significant emotional, psychological impact, because clearly there's been a huge amount of worry and concern about COVID over the past 18 months. In addition, some of the symptoms themselves are quite frightening. Breathlessness, for example, being a key one.
It felt very holistic to me. It felt like each part of the system was talking to the other part. It was also a human touch. There were people who cared and wanted to help. It relieved that one of the major symptoms that was causing me a lot of distress, because anyone with asthma or anyone with breathing difficulties will know that if you can't breathe properly, there's not much else you can think about. Talking about how this had made me feel, there's probably some post-traumatic stress going on, which I understand that from the point of you not being able to breathe for 6 months and regularly having nightmares and having insomnia. There's a lot to talk about there.
In Oxfordshire, we're really ensuring that each individual gets a full holistic assessment, and what I mean by that is a full sort of recognition of all of the medical issues that they may be having, but then also addressing sort of what their goals may be in terms of returning to work, returning to exercise, and then also thinking how that's affected them psychologically.
The other elements of having clinical diagnostics, having lung spirometry, having more CT scans, having CPET test, which is where they put your lungs and heart under stress together and see whether those two organs are working in tandem. But it was really great to have a reassurance that my heart and lungs were working okay. They gave me a series of objective, measurable indicators that told me my body was actually okay. That to me was hugely helpful.
We're able to provide people with some really useful tools and strategies to manage all of those symptoms so that they can then return to work and to family expectations and to exercise and that social interaction that they were completely used to.
We are seeing people recovering. We know that being patient with your recovery process is really important. Keep focused, keep thinking one day ahead. What are the one or two things that I can do? Focus on things that you can get some pleasure from. Have something that you can kind of look forward to, even if that's something very small.
There are no boundaries within long COVID because it's unknown, and so the opportunity to be able to to work and to try different things and to be able to, you know, really listen to patients and understand what it is that they want and what they feel is appropriate, and that's really helped the development of certainly our services.
It really is kind of a multidisciplinary collaboration. It involves not just kind of the hospital team, but the community team, so that people can start their kind of recovery journey in the clinic and then move on to the community, so that they can be followed through and supported the whole way through their kind of recovery, or at least to a point which actually enables them to kind of self-manage their illness.
Individuals, survivors, they want a pathway. They want to know what's next in the treatment of me as an individual, and knowing that there were tests on the horizon, there were things that were coming up. Knowing that there was a pathway for me was huge, because in those first 2 months there was nothing. I just sat on my own at home going, am I dying? Once you get a series of steps in place that help you see through, it's almost like a map, right? It helps you to see through a very difficult time. That made a big difference. It was very positive.
Part of what we're trying to do in clinic is understand people's symptoms more holistically, and then trying to devise individually strategies that we think are most likely to be helpful for that patient. People, when they can engage with some of these strategies, if they're the right strategies and they're applied in the right way, people are improving, and I think that's really reassuring.
You know, you're not alone. There are people in Oxfordshire who can help and will help and are trained to help, and there are steps you can take to become better and to understand more about how this illness is impacting on you. And you know, knowledge is power, isn't it? And I think what the long COVID service has done is empowered me through providing me with knowledge about what the illness is doing to me as an individual.
The most important message for people with long COVID is to learn that you can't push. You absolutely cannot push and challenge out of this. This is you have to listen, you have to sort of respect and respond to the body, and the more you push and challenge recovery, the more it rebels and the more it pushes you back down.
I think what we have learnt in the service is that people do get better, but there is no quick fix. And you know, and it's a long journey, and people do need to be patient.
I know I'm going to get better, and I will get better. It's going to take time, I think, is where we're at. But I've no doubt that in a couple of years' time, I'll look back on this period and think, God, that was tough, but yeah, I'm through it.